I'm Dr. David Morwood. I am certified by the American Board of Plastic Surgery. In my office, I've heard so many questions about how we reconstruct a nipple areola complex that we decided to actually demonstrate this to you on this website. What follows is an actual surgical procedure demonstrating how I perform my favorite way to do nipple areola reconstruction. This is essentially using a technique called the skate flap. The skate flap is a process whereby a local flap using a woman's own tissue, living tissue, still attached to the breast mound, is used to fashion a nipple. Typically, the areola is fashioned by using a skin graft. We take a small piece of skin for somewhere else on a woman's body, oftentimes where she already has a scar, and use that skin graft to recreate the areola or tan part around the nipple. To do nipple areola reconstruction, we oftentimes will need to do lots of measuring. Before the operation, a woman will stand and she can participate in the decision on just where to put the nipple areola complex. Some women ahead of time will take home EKG pads or these little sticky pads, and at home they can stand in front of the mirror and help decide where their nipple areola complex should be designed. For a woman who is having one side or unilateral reconstruction, of course we want to provide symmetry and match the position of the other side. For a woman who is having bilateral or both-sided nipple areola reconstruction, we like to place the nipple at the most projecting point or the apex of her breast mounds. In the operating room, I'll start by making the incision around the circle. Following this, I will raise the skate flap. Now again, the flap is still attached to the woman's body. It's part of her own living, breathing tissue. And the projection of the nipple can be variable. Some women have markedly projecting nipples, some women have somewhat under-projecting or flatter nipples. This is all, again, part of a custom-designed surgical approach. In the next few minutes of this video, you'll see an actual surgical procedure on how I use a skate flap to develop the nipple. You'll also see how I take a skin graft, a small piece of skin from somewhere else on the body, and use that to make the areola or tan part around the nipple. Sometimes in my practice, women will ask me if there's a way to do nipple areola reconstruction without taking a skin graft from somewhere else on their body. Primarily, this is for a woman who does not want a scar anywhere else. There is a way to do nipple areola reconstruction without taking a skin graft from somewhere else. It's actually a variation of the skate flap, or something I call the omega flap. Typically in my practice, I will find that the nipple doesn't project as much with this variation. In my hands and in my practice, I find that the use of this flap, or the omega flap, doesn't provide a nipple that projects very much, but it certainly will allow us to do nipple areola reconstruction and not take a skin graft from anywhere else. Some months following nipple areola reconstruction, a woman has the option of undergoing tattooing to make the nipple areola seem darker. That can be very effective for providing a color match to the other side, or even in bilateral nipple areola reconstructions if a woman would like a darker or a different color shade to her reconstruction. It always surprises me that some women in my practice feel that it's not important for them to have a nipple areola reconstruction. However, uniformly, women are delighted to have that final stage completed. It really helps them to feel whole again.